All right, so we're going to be talking about the diagnosis and treatment plan sheet. This is the sheet that we use. This is the paper that we use when we want to communicate our findings and our treatment recommendations to the people in the front desk so that they can start entering the treatment plan in the system. So our treatment plan sheet has different sections. You're going to notice that the first section has the patient's name and patient's date of birth. So that's the first thing we're going to enter. Make sure that you got the spelling of the name correctly and the patient's date of birth, because we are going to be using that as a reference later. Then, of course, we're going to be entering what is the reason that the patient came into the office. So in the case of this patient, it says, I broke a front tooth while I was ice skating and I'd like to get it fixed. Then any kind of additional information like the patient's blood pressure, which in this case is 128/82, and the patient has a history of anxiety. The next thing on the lower part of the page is you're going to enter the date in which this diagnosis is going to be made. And you're going to see that there's a few columns. The first column is for the tooth number or the tooth that's going to be treated. Then the next column is going to be for the surface, the quadrant, or the arch that's going to be treated. The next column is where you're going to be entering the procedure or the treatment plan that's being recommended by the dentist. And the last column is the diagnosis or the findings, the reason why we need to do the treatment of that patient. So as an example, on this patient, on tooth number 9, we are going to be doing a surgical extraction. So surgical extraction for tooth number 9. And because we're doing an extraction, we're going to be replacing that tooth with an implant, abutment, and crown. And then, of course, the patient is going to be needing something in the meantime. So we're going to be doing an Essix retainer. It's going to be a retainer to help the space open. And this Essix retainer, we have to specify that it's for the upper arch, of course. And the diagnosis is because tooth number 9 is fractured below the gum line. And that's why the tooth needs to be surgically removed. The tooth also has root decay. Then the next thing this patient is going to need is localized scaling. Localized scaling, since it says localized, we want to clarify where exactly in the mouth he's going to be needing this localized scaling. So that's going to be for number 18 and 19. Teeth number 18 and 19 need localized scaling. And the reason is because there's localized periodontal infection or periodontitis, and there's presence of 6 to 7 millimeter pockets. And we're also going to be placing Arrestin, which is antibiotic that goes tucked in between the tooth and the gum. So that's going to be for tooth number 18. And Arrestin is placed on a specific spot. So we're going to use the teeth surfaces to convey that information. So that's going to be on the mesial buccal or MB. So tooth number 18 needs Arrestin on the mesial buccal surface because there's a 6 to 7 millimeter pocket in that area. And the rest of the mouth, the patient needs light scale and prophy. It means there's no infection, there's no inflammation, there's just light scaling and prophy. And because of that, this patient will be scheduled every 6 months. Now, on tooth number 19, the patient needs a filling. He needs a composite filling, and the filling is an MOD composite. Now, it's very important that when entering the surfaces, when we're writing down which surfaces the filling will need to be done, we clarify with the doctor which surface exactly, because MOD may sound like MOB. So you need to clarify if this is a buccal. So you need to clarify if this is a buccal filling or a distal filling. So mesial, occlusal, distal. When we have a mask on, sometimes communication doesn't come out too clear. So it's important to rephrase or clarify with the doctor to make sure that you got the correct information and that this information is accurately transferred to the front desk for entering it in the system. And also, we want to make sure that every single procedure has a diagnosis. So in the case of this tooth, it's because there's caries, there's a cavity in the tooth. Now, tooth number 30, we need to cut and remove a porcelain-fused to metal crown. So the patient has an existing crown, and that needs to be cut and removed. And we need to do a new crown with gingivectomy and buildup. So number 30, gingivectomy, buildup, and crown is the procedure. And the diagnosis for that would be recurrent caries under that existing crown that we're removing. And the last thing this patient is going to need is a night guard. So this is an example of how to fill out a diagnosis and treatment plan sheet. And on the next video, I'm going to be recording a couple of different examples. So for the next video, you're going to be able to practice how to fill out a diagnosis and treatment plan sheet, just like we did with this one. So you're going to have 2 blank treatment plan sheets, and I'm going to be dictating 2 examples to you. And at the end of each example, you're going to be able to compare your notes with the notes on the screen. So go ahead and get your 2 pages, 2 blank pages, and I'll see you on the next video.